It's a great pleasure for me to introduce this programme on Raynaud's and scleroderma. Raynaud's is really a rather common condition. It affects some 10% of any female population. It can be quite mild when you might only need to wear woolly gloves or a woolly hat as you lose 25% of your body heat through your head, or it might be very severe. It might occur many times a day and you might require drug therapy. There are many drugs that you can use, for example, nifedipine or diltiazem. And we produce a list of drugs which we hope are helpful to general practitioners when they're trying to decide what would be best for their patient. Patients can be rather idiosyncratic, and what suits one patient may not suit another, so it's worth trying in rotation several drugs. Raynaud's can be the forerunner of a much more serious disease, and that is scleroderma. Scleroderma is rare. It's sometimes called an orphan disease. It's called orphan because, unlike common diseases such as myocardial infarction, it doesn't attract great resource, it doesn't attract researchers, and it's therefore considered an orphan condition. The good news is that today there are many centres around the country who do have a special interest and do have doctors who have an expertise in scleroderma. So it's very important to recognise the early symptoms. Patients present to general practitioners often with puffy skin. The skin can be irritable. It becomes hard quite quickly. Another sign is arthritis or muscle aches and pains. Once these signs have been discovered and reported to a general practitioner, it is a very good thing to get the patient to a specialist as quickly as possible, because there are now some rather special drugs that will help the worst form of this condition.